Hello, this is Dr. Gay from First Lick MRI, and this is a 16-year-old male who's a football player. He plays running back for his high school team, and he's had back pain for a while this season, but was really bad the night before this MRI. Was aching during the game, had a hard time playing, and on this view, we see a side view, sagittal view of his lumbar spine. We can see towards the front over here, this is the belly button to get oriented. This bright area is the normal subcutaneous fat in the back. These squares are the vertebral bodies of the lumbar spine, and then down here is the sacrum and coccyx. Now between one of these squares we see a little area of brightness here. This is a disc. This is a soft disc that acts as a shock absorber. We see white stuff here. This is fluid in the spinal canal. You can see the spinal cord, which is dark, surrounded by that bright fluid. And there's a spinal canal. In the back here we see the spinous processes. We call these the posterior elements. And these front areas, the vertebral bodies, and the posterior elements they communicate here on the sides. And this patient has something that's obvious right down here. This is an abnormal disc. Disc should look like this, bright, nice and tall. This disc is collapsed just a little teeny bit, and we see that there's disc material that has squirted outwards and gone up. So this is a disc herniation or a disc extrusion, and that extruded disc fragment goes backwards into the spinal canal. It goes up a little bit. So this is part of this patient's problem. If we roll off to the right, we see the foramen, which is a hole, and you can see the nerve going through that foramen. So again, this is a foramen, that's a nerve, this is a nerve, this hole is the foramen. We see something on this that is abnormal. In addition to having that disc herniation here centrally, the patient also has some bright signal right here and right here. So this is the part that connects the front to the back. And this is called the pedicle, and this is called the pars interarticularis. And this is a facet joint from the top coming down. This is a facet coming up to the top facet joint. And this patient has marrow edema, indicating that there's a stress injury. And if we look right here, there's a vertical line here. This is a fracture. This patient has a fracture of their pars interarticularis, or we call it a pars defect or pars fracture. This is on the right side. We're going to go across to the left side, and the patient has the same thing. There's bright signal here, and we don't see that continuity of bone. I put up some thin images here to see a little better detail. And these images are T1, the patient moved, so these are a little bit blurry, but there's an arrow pointing to this vertical fracture line right here. And this one we can see this continuity of bone, the pedicle here going down to the superior articulating facet. And there's no fracture there, but right here the pedicle comes over, vertical fracture line, and here's that articulating facet there. So bilateral L4 pars fractures. There's that vertical fracture line, and the bone is discontinuous right here. And this one we can see a little bit better on these thin images. Right in here is the fracture, and if we go to the other side, right in here is the fracture surrounded by that bright marrow edema. Thank you very much.